DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.
Hey folks, welcome to DocTalk. Thanks for joining me today. Today we're going to talk about bovine respiratory disease. We're going to talk about everything from gathering the history on a group to what we're going to see in the pen to what we see in the chute. Going to be a good show. Stay tuned.
Stressors that trigger bovine respiratory disease are all around. So when you spot BRD in your herd, turn to Zuprevo, the fast that lasts. Zuprevo is rapidly absorbed in as little as 45 minutes and lasts up to 28 days. Because in the race against BRD, you need to win. Ready, set, Zuprevo. In case of human injection, seek immediate medical advice. For use in beef and non-lactating dairy cattle only. For prescribing information, talk to your veterinarian or visit Zuprevo.com.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thompson, and I'm an owner, practitioner in production animal consultation, and I'm also a part-time, half-time faculty member at Iowa State University. Really a unique opportunity to help with education and maintain my veterinary practice. Today, we're going to talk about something that is something we deal with on a day-to-day basis, and I have some really cool video to share in a feed yard that I was at in Northwest Iowa. But as we look at disease in general, or we look at ailments in general in feed yards, you know, there's some stepwise processes as veterinarians and as producers that we really need to take a look at. And so when we start to see an increase in spike of morbidity in a feedlot or from bovine respiratory disease, if we're seeing an increase in lameness, or we get into the early fall and we start to see an increase in buller activity of cattle, you know, first thing we have to do is stop and take a history. And a history as a veterinarian, and you as a producer, you may think that I'm just going to walk in and automatically know that you're having a lice problem, or automatically know. I may have some observations, spending some time, but to really get to the root cause and really understand what's going on, as a veterinarian, the first thing I have to do is I have to sit down and get your perception on your operation of what's going on. I also need to know, has this been going on for a week? Has this been going on for 2 weeks? Has it been going on for a month? Really, really important. I also need to know, is it about the same? Is the same number of head, the same level of severity per animal? Or is this something that is going up in progression of disease or progression of severity, or including more animals? And so I think those are really, really important parts of the history. The other parts of the history are the signalment. And so I'll ask you, you know, is this affecting just the heifers, or is this affecting heifers and steers? Is it, if it's a cow herd, you know, is it age? Is it the replacement heifers versus the cows? And some of these different things. And then within the age, breed, gender, it might be the stage of production. You know, are these animals pregnant? Are these animals newly received to the feed yard, and where are they at on ration? And so those are some things that we'll ask. Some of the other things that I'll ask when I take a history is, I'm gonna, you know, what have we done vaccination wise? What have we done diet wise? What have we done with maybe dewormers, water source, environment? As we start to think about this, when I start to ask questions like, have we upped the roughage? No, we've stayed pretty much the same roughage level, but is it the same roughage source? Well, no, we're into new cutting or a different type. We're out of the grass hay, we're putting a new green chop type alfalfa in the diet. Lots of different things that could be stimulating phytoestrogens and things to that nature as we look at some of these issues. Water source, you know, do we hit a dry time of the year where we can't source all the water from one pond, and now we're blending it from a well or from another source, and when did that occur? Environment, have we had, you know, rainfall? Have we had temperature fluctuations? All of these different things are going to go into the history before I start to come to some diagnosis and start to understand before I go out and look at the clinical signalment in the pens or in the pastures. History is vitally important, and more on that when we come back. We're going to take a message. You're watching DocTalk.
I'm Dr. Les Anderson. I'm a beef extension specialist at the University of Kentucky. The Alert Is On Farm test has the opportunity to completely change the industry. A producer is enabled and empowered to be able to take the sample and run the test or tests at their leisure without scheduling anybody. And honestly, reproduction is the thing that we measure the least, and it's the thing that dictates profitability the most. The Alert Is On Farm test will help us to identify cows that get pregnant early. It'll improve our efficiency tenfold.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
ValleyVet.com is your one-stop shop for your every animal need. From prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, Dr. Dan here. Glad to have you with me here on DocTalk. I'm in Ames, Iowa, where I practice veterinary medicine. I teach and do research at Iowa State University. And as we're leaving, one of my favorite stories about not taking the time to collect a history was I had a new associate hired. We were in West Texas. He's a brand new veterinarian. We did a necropsy in front of the crew. We got done with it, and there was a little speck of BRD or pneumonia in the lung, and my associate veterinarian went through and explained the pathophysiology of bovine respiratory disease and how that progressed in the animal until the animal died. And he looked up and asked the person, the hospital, the doctor there, you know, what'd you think of that as far as the explanation of death? And they said, we thought it died because we hit it with the feed truck this morning. So it's really, really important to start with a history and have an understanding of what you're going through every day when we come onto the farm. So now let's go into bovine respiratory disease. And it's, you know, in the fall, it's the number one cause of illness, the number one cause of death in feedlot cattle. And so when the first thing that we have to do is identify sick cattle in the pen. And we have not done a very good job of being able to identify sick cattle in the pen, because cattle, until they know that we are caregivers, they will hide their clinical signs from us. And so, but once they start to get either so sick that they can't hide the clinical signs, or they trust us and show the clinical signs earlier in the disease process, the acronym we use for finding cattle that are sick with respiratory disease is D.A.R.T, okay? Depressed, anorexic, respiratory, temperature. So in the pen, we can find animals that are depressed, or maybe they're alone, maybe they're by themselves. Their head's down, their ears are down, they aren't alert when you come into the pen. That's pretty obvious one. Anorexia. These are animals that are off feed. Anorexia means to not eat. And so if we start to see an animal that's gant or slab-sided, that's an animal that, whether it's truly sick or not, something's going on that we better get that animal in and check it out and take a look at it. Respiration rate. That's another thing that we're going to look at. Is this animal breathing heavy? Is it breathing fast? Has it changed compared to just normal respiration, meaning that there's something wrong with bovine respiratory disease? There are other things that we can examine in the pen, such as a dry nose or severe clear running nasal discharge, some of those types of things. But we can't evaluate the body temperature out in the pen, so we have to get them in. So understanding that is vitally important. Now, one of the things that we use on a day-to-day basis in our feedlots is we try to match, especially with high-risk calves, because not every calf will show these signs of depression, anorexia, and respiratory rate. We will use different methods such as walking those pens or riding those pens when we offer first feeding, especially as we get into these cooler months. And a lot of times that will expose those animals, and I have some video of how we do that I'm going to come back to here as we take a break. So let's take a break. When we come back, we'll have some video on how we identify some cattle. We'll also go through some things we do at the chute side to better evaluate and how to treat those cattle with bovine respiratory disease. You're watching DocTalk, and I'm glad you joined us.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Dr. Nels here, folks. We're super excited about this book on hiring. Have you made a bad hire? Have you hired someone you wish you wouldn't have? Are you looking to hire? It's a great short read on helping you in the hiring process. You can find it on Amazon, Kindle, Audible, or find it at drnels.com. Check it out there. We'd love to see you there.
ValleyVet.com is your one-stop shop for your every animal need. From prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thompson here at Iowa State University, and I'm a feedlot practitioner that spends a lot of time in feed yards. And as we left, we're talking about finding cattle that are sick when we feed them. And here's a video that I'm going to share with you. This is at Hanson Feed Yards up in Hinton, Iowa. Rick and Patty Hanson, great people. This is Justin and Miguel that are out in the pen. You can see that the tractor's coming in the feed wagon, and we keep these cattle pretty aggressive. And we're going to feed these cattle, and you're going to see that how aggressive they come to the bunk. And obviously they're hungry. And one of the things about using feed, a lot of times when we pull cattle, there's times where we pull cattle that are ugly, but they're not sick. And using the feed and how these cattle come. But then look at this critter standing out here all by itself. The only one in this pen of 200 and some head that's not coming to there. And sure enough, as any good caregiver would do, here comes Miguel up to take a look at this animal. This animal was, if we wouldn't have timed this at the time of feeding, this animal was full. This animal was alert, and this animal didn't have respiratory signs. So sometimes using feed can help us identify those animals that maybe are just a little bit off before they're held off feed too long, and then we're able to get these animals in the pen. So we're going to grab this animal. You can see Justin and Miguel are going to move him out of the pen. We're going to take him up to the hospital where we're going to put him in the chute, and we're going to do a physical exam on this animal. And as you can see, this animal standing here in the tub right now, pretty alert, got a belly full of feed, not one that when we described the D.A.R.T method that we would have probably gotten if we wouldn't have matched this up with feeding. So the first thing I'll do when we get the animal in shoes, I'm going to look at the head. And I want to look at the eyes. If the eyes are sunken in, that means dehydration. If when we get chapped lips, when we get sick, cattle get a chapped nose. This steer has a severe nasal discharge that is watery, that sometimes we associate with a viral pathogen. Ears are alert, heads up. I'm going to go back then to the side, and I'm going to look and see if this animal is gant or not gant as part of my physical exam. And then, of course, we're going to go in there, and you can see where Miguel is right here, taking the rectal temperature or the body temperature, and sure enough, this animal temped 106.0. Normal body temperature for bovine cattle, especially in the fall, because it's not going to fluctuate, go up because of heat stress, is 101.5 to 103.5. Anything that's 104 or above, running a fever, we're going to consider that animal to be having some sort of viral or bacterial disease, and that is an abnormal body temperature. But not eating, alone in the pen, physical exam, sunken eyes, nasal discharge, not eating, rectal temperature of 106, we're gonna treat that animal. So when we come back, a little bit more. We're here at DocTalk. Thanks for joining us.
We see you, working hard from the early mornings to the late nights and every hour in between. We see you. We see the pursuit, the desire, the effort, the hope, the goal of being a champion. And we see that you need a partner to keep your animals healthy and happy. With our countless products and quick and reliable shipping, together, we can do just that. To the cowboys and cowgirls, to the dreamers, we see you.
We're the Iowa State University Beef Teaching Farm, and we're grateful to be part of an industry that's built on relationships.
We are a start-to-finish yard. Bring them in at 500 pounds and finish them out to 14 to 1,500 pounds. Max capacity is about 15,000. We begin with the end in mind, which that means it starts from day one coming off the truck. The most stressful part of the life cycle of a calf is the ride here, whether it's a 2-hour ride or it's a 24-hour ride. I mean, we kind of treat everything like the higher risk cattle. We always have somebody right there at the loadout, pinning cattle, getting counts on cattle. It's just consistently doing the little things right, whether it's clean water, fresh feed, clean pen, clean bunk apron. We try to do the little things right, whether it's from low stress cattle handling, animal welfare, how we work with the cattle every single day. You know, that's something we really focus on. Our cowboys work directly with our veterinarians. You know, and our guys, they do a great job. Give them a few days to kind of acclimate, settle down a little bit. That gives us a period what we know what we're working with and how we're going to handle them at the chute when we come to process them. We don't process till day 10, 14 or so, and we found better luck with that just because we know what we're working with. And it seems like if they're going to fall apart on you or, you know, start having some BRD issues, you'll find it within that 10 to 14 day period. And Mother Nature, as we know, it can throw a curveball at us anytime, so you never want to get comfortable. And we're using a stimulator now for a vaccine, and they don't go through a harsh sweat or anything. Blends, mix is really nice. Cattle look great afterwards, and every day is a challenge. But it's nice knowing that we can rely on a good vaccine, kind of protect us against what Mother Nature or any stressors that they throw at us. This industry, it takes everybody, whether it's working with the nutritionist, it's cowboys working with the veterinarians. Everybody plays a part, and we expect them to do their jobs, but also we expect, you know, the drugs or what we put into the cattle to do their job too. And I think these Bimeda products, they're proving that they're doing the job for us.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thompson, and we're talking about respiratory disease. And While we're there, we pulled another calf to the chute, and I'm just going to kind of walk through our physical exam and what normals are and abnormals. But the first thing is I'm going to look at this calf's head, and as you can see in this video, its eyes got some discharge. They're sunken in. You can see that when you look at the nose, there's the constant nasal dripping, that clear nasal. I don't get as shook up about just a mucus plug or somebody blowing their nose, but when it's constantly running like this, it's something that's abnormal. We'll also look to see the nose, and a lot of times we'll see a dry nose in these animals. Then I'm going to move back to the back end. We're going to take the rectal temperature of this animal, but I'm also going to examine as you can see here, I'm going to examine the lumbar fossa area, and you can see that this calf has been off feed and not been eating. So this is the anorexia. So normals for cattle, normal rectal temp is 101.5 to 103.5. Normal respiratory rate in a bovine is 10 to 40 breaths per minute. Normal heart rate is 60 to 80 beats per minute, and normal rumen contractions are 1 to 2 per minute. And you're like, well, how do I measure rumen contractions? Well, if you don't have a stethoscope and you can't listen to them, you can actually take your fist and put it right in this left lumbar fossa, and as you press down, you'll actually feel the rumen contractions as they move underneath your fist. I'm going to look at respiratory rates. I'm going to look at the head. I'm going to look at the paralumbar fossa. I'm going to take a temperature. And then once we have that, we're going to take this to the animal health computer. As you can see, Justin, he's going to enter this information that we take, whether it's a lung score through auscultation or whether it's a body temperature. We're going to put that into the animal health computer, where as a veterinarian, I have set up our treatment programs based on the SIGNALMENT, which is age, gender, days on feed, things to that nature, along with the clinical definition or the clinical signs. What did we see as far as lung score, rectal temperature, and then that will then give Justin and Miguel the treatment protocol or the treatment plan for this critter that's in the chute. And you can see, and then we administer the product, and then hopefully when we send this animal back to its home pen, it's going to not come back to us for a second treatment and get along just well. What do we expect from our treatments? We expect 80% of the animals that we treat first with respiratory disease to never come back for a second treatment. Of those that come back for a second treatment, about 50% of those come back for a third. And of the ones that come back for a third treatment, about 50% of those go on to normal pack. The other 50% wind up being railed or died. So as we look at this and measure our case success, and constantly look at these numbers, these are some of the things that you should do when doctoring the cattle with the right clinical case definition and the right treatment protocols, working underneath a valid veterinary client-patient relationship. Sure appreciate you watching DocTalk today. Remember, if you want to find us on the web, you can find us at www.doctalktv.com. Always work with your local veterinarian. I'm Dr. Dan Thompson, and I'll see you down the road.
DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.
Stressors that trigger bovine respiratory disease are all around. So when you spot BRD in your herd, turn to Zuprevo, the fast that lasts. Zuprevo is rapidly absorbed in as little as 45 minutes and lasts up to 28 days. Because in the race against BRD, you need to win. Ready, set, Zuprevo. In case of human injection, seek immediate medical advice. For use in beef and non-lactating dairy cattle only. For prescribing information, talk to your veterinarian or visit Zuprevo.com.
Valley Vet Supply sees the hard work and effort of you and your animals to achieve your goal of being a champion. And we're here to help along the way. To the cowboys and cowgirls, to the dreamers, we see you.